my biggest issue with things that you've said is you have put out the sentiment that COVID vaccines, specifically mRNA vaccines, are killing thousands of people. And you're giving the impression that they're dangerous and that they shouldn't be taken. And that is, I guess, the biggest issue that I have with your communication. And I'd be curious to see what you have seen that brings you to that conclusion.
Okay, that's interesting. All right. I mean, I think there were many criticisms prior to this in terms of the lockdowns and things like that.
We can get to that
Sure.
too, but yeah.
Yeah, sure. Okay, I'm happy to start with the shots if that's where you want to start. So, and by the way, I'm not going to do any I don't do politician answers. So, but in the course of some of my answers, I might ask you questions so that I know that we're coming from the same place in terms of statistics and numbers and things like that. And if there's something that needs to be corrected or we're coming from different sources, then it can be clarified. So I'm going to lay out what my position is. I think that you've partly got it right. I would say that I know for sure I have never told anyone not to take the shot. My position has primarily been throughout the thing, you can from beginning of 2020, has been opposed to the mandates, opposed to the coercion, and opposed to the lies and just the dishonesty, in my opinion, coming from the media, coming from politicians, coming from so-called public health experts, not just, I mean, in different countries. I'm from the UK, but I think wherever you go, the messaging was largely similar. So my personal viewpoint is based off of, firstly, just starting out with how, you know what, actually, I think a good place to start would just be how dangerous / deadly we both think that COVID itself is, because I think that perhaps we don't see eye to eye on that. And as a result, everything that follows, we are missing each other on. Mm-hmm. So my viewpoint, well, I mean, not my viewpoint. I mean, look, I actually, before this conversation, to make sure that I'm not like just sort of running things off of my feelings, I wanted to check the infection fatality rate by different mm-hmm. age groups. So the numbers that I have seen, I have got a link to this, but based on the numbers that I've seen, for the various age groups, the median infection fatality rates that I've got for age 0 to 19 years old is 0.0003. For 20 to 29, 0.002%. From 30 to 39, I've got 0.11%. From 40 to 49, I've got 0.035%. From 50 to 59, I've got 0.123%. And from 60 to 69, I've got 0.506%. And then from age 70 upwards, it increases over 1%. Firstly, I want to say, do those numbers align with your own sources?
So is that the infection fatality rate or is that the case fatality rate?
I have that as the IFR, the infection fatality rate.
Okay. So I would look at case fatality rate if I was going to look at any number like that. But to be fair, those numbers sound like, I'll just agree, sure, they sound in the ballpark of what the case fatality rate would be. But case fatality rate is a better metric to look at for that. But
okay.
Were you going to say something else? Or
I was going to just say, would it be fair to say for people aged under 70, under 1%?
Pre-vaccine, aged under, it was around 1%, non-age adjusted. So pre-vaccine. So below a certain age group, it was going to be below 1%. Yeah.
Okay. All right, cool. I just want to make sure that we're aligned on that, because a lot of my thinking, not all of it, but a lot of it is based off of the fact that I do not believe that for the vast majority of the population that COVID is a serious threat or ever was. I've never made the claim that for elderly people or that for people with various comorbidities and so on, that it isn't. And I know that there's exceptions to this. I know that there have been young people who have had a bad and a rough time with it. I'm fully aware of that. I don't think I've ever claimed that isn't the case. But when I look at the overall response to it, I do not believe that the response, I'm talking about lockdowns, I'm talking about the various types of mandates, the rules and restrictions implemented in various countries, the coercion, the segregation, the discrimination, all of the stuff that came out of it, and all of the long term, all of the ongoing effects that that's having in terms of the economy, in terms of civil liberties, in terms of people's mental and physical well being, in terms of inflation, and so on. I do not believe that it made sense. I would go as far as saying I believe that the impact of the policies has been and will be worse, in my opinion, than the impact of the disease itself. I also think that many of the policies themselves did not make sense. I know that you're a science guy, you're all about science. I think that many of the policies that were undertaken around the world were illogical, let alone like they didn't make any sense in terms of science. So if you're willing to, if you're able to change my mind on some of those, I'm happy to give examples. If you feel differently on those, I'm not going to make you defend every stupid policy. If we want to go through some of them, we can see the ones that you think make sense and the ones that perhaps you don't think do. But I'm giving you my overall perspective. My perspective is generally one of choice. So if someone, I've never in my life told anyone to, I've never even asked anyone their vax status. I've never once yelled at anyone for wearing a mask or not wearing a mask, for taking a shot or not taking a shot. My stance has always been this should be up to people. If individuals do their own risk calculation for themselves and their family, and they think that it's best to stay home, or they think it's best to close down their business, or they think it's best to wear a mask or wear two masks or take 0 shots, 1 shot, 5 shots, however many. I've never cared about any of that stuff before with any other illness and with most health things in general. I think it's up to individuals. That's been my stance. My stance has been anti-mandate. You could call it anti-mandate. You could call it anti-lockdown. I would simply say that it's pro-freedom, pro-civil liberties, and it's also just pro-transparency of information. One of my biggest beefs throughout this whole thing has been something you touched on earlier, which is about the communication. And I think that the communication has been awful. And I think that the part of the reason it's been awful has been because I don't even want to go too deep because I don't want to just like throw tons of stuff out here. But yeah, I do think that there are ulterior motives. I don't think that the people who were rolling all of this stuff out necessarily had the best intentions of the entire population in mind. And I'm not some super deep conspiracy theorist. I'm not here like saying that I think, the shots are turning people magnetic or 5G's out here going to, kill everyone or everything like that. I just don't think that in a remotely free society, you should be forcing injections on people or you should be forcing masks on people, let alone children, but I don't think adults either. And that has generally been my perspective. I don't think that the government's even had a right to do many of the things that they have done. So I've given you a lot there. You're
Yeah,
welcome to take that away.
that's a lot.
I'll allow you to respond. Yeah.
That's a lot. So let's. I think first we'll start back at how dangerous is COVID? How much of a threat was it, and how much damage did it cause?
Okay.
So I think looking at an IFR, an infection fatality rate, is going to give you a significantly limited perspective on how much of a threat it is, because a infectious disease with a low fatality rate but high infectious rate can still cause a lot of damage. And remember that death is not the only bad outcome that we want to prevent in people when it comes to a new virus like SARS-CoV-2. You could die from it. You could also be hospitalized. You could be admitted to the ICU. You could end up with long COVID. None of those things are things that people want. And those are all things that we want to prevent in terms of public health, right? The more of those things we prevent, the more people live, the better the economy can do with more living, working people, et cetera, et cetera. So COVID did kill millions of people around the world. The majority of those people were older, but it did still have a significant effect on younger people. And when it comes to those younger ages and all ages, really, it's not so much of a question of what's the absolute risk that COVID poses to me? It's what option am I better off taking, right? Like, am I better off with the vaccine or without the vaccine? Am I better off wearing a mask in certain situations or better off not doing so? And we can interrogate those questions and with science and gather data to answer those questions. Um, and so when it comes to things like vaccines, in all age groups, it's been shown that you are better off per capita uh, being vaccinated than not being vaccinated for all of those bad outcomes. And I guess maybe the best example uh, of this is that in Korea, for example, there's a really big data set from Korea. Uh, there was one study that looked at the adverse events and harmful effects of vaccines in a population of about 42 million people. I may be getting that number slightly wrong, but it was in that ballpark. And they looked at even looked at deaths that can be associated with the mRNA vaccines. And when it came to people 18 and under, 0 people died that they could associate with the vaccine. However, in that same country, out of fewer COVID infections, so fewer than the 42 million vaccinees that I just talked about, out of a cohort that's smaller than that, there were about 46 deaths in age 18 and under.
Is
And
this over? So just to be clear, what time period is this over? Is this over the entire time period, the two
so
and a half,
this
3 years?
these time periods were similar time periods.
Okay.
Um, I'd have to look at the papers to get you the exact times, and I can definitely do that for you. But
Okay.
they were similar time periods, and there were about 46 deaths in people aged 18 and under uh, in that country from COVID. And the biggest risk factor for them was being not vaccinated. So you see a data set like that, and that can give you a big picture perspective. But then we can also drill down to individual cohorts. We can do more detailed studies looking at different groups from all over the world. We can look at different outcomes. Yeah.
Sorry to jump in there. Do you know what, out of those, let's say the 46 young people who you said died, was that of COVID directly from it?
Mhm. Yep.
Yeah. Do you know what percentage of those had comorbidities versus not, just to be
So,
clear?
so the biggest risk factor was being unvaccinated. More of them were unvaccinated than had comorbidities.